Blood pressure is the force of your blood pushing against the walls of your arteries. It's a vital sign that helps us understand how well our cardiovascular system is functioning. Blood pressure readings can provide crucial insights into our overall health and can indicate potential health issues before they become serious problems. Think of it like water pressure in a hose. Just as water pressure can vary depending on how much water is flowing through the hose and how narrow or wide the hose is, blood pressure can vary based on the volume of blood being pumped and the condition of the arteries. Just like that hose, your arteries carry blood throughout your body. The heart acts as a pump, pushing blood through these vessels to deliver oxygen and nutrients to your organs and tissues. The efficiency of this process is reflected in your blood pressure readings. We measure blood pressure with two numbers like a fraction. These numbers represent the systolic and diastolic pressures, which are essential for understanding the dynamics of blood flow in your body. The top number is the systolic pressure. This measures the pressure when your heart beats, pushing blood out into the arteries. It's the higher of the two numbers and indicates how much pressure your blood is exerting against your artery walls during heartbeats. This measures the pressure when your heart beats. It's a critical indicator of how hard your heart is working to pump blood. The bottom number is diastolic pressure. This measures the pressure when your heart rests between beats. It's the lower of the two numbers and shows how much pressure remains in the arteries when the heart is at rest. It measures the pressure when your heart rests between beats. This resting phase is crucial for the heart to refill with blood and prepare for the next beat. Healthy blood pressure is crucial for overall well-being. Maintaining it within a normal range helps ensure that your heart and blood vessels are not under excessive strain, reducing the risk of heart disease, stroke, and other health issues. It ensures that your organs receive the oxygen and nutrients they need to function properly. Proper blood flow is essential for the health of every organ in your body, from your brain to your kidneys. However, when blood pressure is consistently too high or too low, it can signal underlying health issues and increase the risk of serious complications. High blood pressure, or hypertension, can lead to heart attacks, strokes, and kidney damage, while low blood pressure, or hypertension, can cause dizziness, fainting, and shock. Understanding the difference between high and low blood pressure is vital for maintaining good heart health. By monitoring your blood pressure regularly and making lifestyle changes as needed, you can help keep your heart and blood vessels in optimal condition, ensuring a healthier, longer life. High blood pressure, also known as hypertension, is often called a silent killer. This is because it often has no symptoms, but it silently damages your arteries and increases your risk of serious health problems over time. High blood pressure occurs when the force of blood against your artery walls is too high for too long. Several factors can contribute to hypertension, including genetics, age, lifestyle choices, and underlying medical conditions. While symptoms may be absent, some individuals with hypertension may experience headaches, dizziness, nosebleeds, or shortness of breath. Untreated high blood pressure significantly increases the risk of heart attack, stroke, heart failure, kidney disease, vision loss, and other severe conditions. Low blood pressure, or hypertension, is generally defined as blood pressure that is lower than 90/60 millimeters of mercury. While low blood pressure might seem desirable, it can sometimes lead to inadequate blood flow to vital organs, causing symptoms and potential complications. Unlike hypertension, hypertension often presents with noticeable symptoms such as dizziness, lightheadedness, fainting, blurred vision, fatigue, nausea, and difficulty concentrating. Several factors can contribute to low blood pressure, including dehydration, prolonged bed rest, certain medications, hormonal imbalances, and underlying medical conditions affecting the heart, nervous system, or endocrine system. Understanding the key differences between high and low blood pressure is crucial for appropriate management. High blood pressure is characterized by a sustained elevation in blood pressure, often without noticeable symptoms in the early stages. The causes of hypertension are often multifactorial, including genetics, lifestyle choices, and underlying medical conditions. Low blood pressure, on the other hand, is characterized by a drop in blood pressure that is often accompanied by noticeable symptoms. While low blood pressure can sometimes be a sign of good health, particularly in athletes, persistent hypertension can indicate underlying health issues. Recognizing the distinct characteristics of each condition is essential for seeking appropriate medical attention. Section 5. Recognizing red flags. When to seek help. Understanding when to seek medical help is crucial for maintaining your health and well-being. It is important to monitor your blood pressure regularly. Keeping track of your blood pressure can help you detect any unusual changes early on. This can help you know if it is in a healthy range. A healthy blood pressure range is essential for your overall cardiovascular health. If you have high blood pressure, it is important to work with your doctor to manage it. Your doctor can provide guidance on lifestyle changes and medications that can help control your blood pressure. If you have low blood pressure and experience symptoms such as dizziness, fainting, confusion, rapid or weak pulse, it is essential to take these symptoms seriously, or chest pain, seek immediate medical attention. These symptoms could be indicative of a more serious condition that requires prompt medical intervention. These symptoms could indicate a serious underlying condition requiring urgent care. Do not hesitate to go to the emergency room if you experience any of these warning signs. Additionally, if you have been diagnosed with either high or low blood pressure and experience any new or worsening symptoms, it is important to stay vigilant and proactive about your health. Consult your healthcare provider promptly. Early consultation can prevent complications and ensure that you receive the appropriate care. They can assess your condition, adjust your treatment plan if necessary, and address any concerns you may have. Regular checkups and open communication with your healthcare provider are key to managing your blood pressure effectively. Lifestyle modifications play a vital role in managing both high and low blood pressure. For individuals with hypertension, adopting a heart-healthy lifestyle is paramount. This includes following a balanced diet low in sodium and saturated fats, engaging in regular physical activity, maintaining a healthy weight, limiting alcohol consumption, and quitting smoking. For those with hypertension, staying adequately hydrated by drinking plenty of fluids throughout the day is crucial. Additionally, consuming small, frequent meals can help regulate blood sugar levels and prevent sudden drops in blood pressure. While we often categorize blood pressure as consistently high or low, some individuals experience fluctuations in their blood pressure readings. This means their blood pressure might be high at times and low at others. Several factors can contribute to fluctuating blood pressure, including dehydration, emotional stress, certain medications, and underlying medical conditions such as endocrine disorders. If you notice significant fluctuations in your blood pressure, it's important to consult your healthcare provider. They can determine the underlying cause of these fluctuations and recommend appropriate management strategies. Fluctuating blood pressure can sometimes be a sign of an underlying health issue, so it's crucial to address it with your doctor. Many myths and misconceptions surround blood pressure, often leading to confusion and potentially harmful practices. One common myth is that only older adults need to worry about high blood pressure. However, hypertension can affect individuals of all ages, including young adults and children. Another misconception is that low blood pressure is always a good thing. While some individuals naturally have lower blood pressure without any adverse effects, persistent hypertension can signal underlying health issues. It is essential to rely on accurate information from reputable sources and consult your healthcare provider for personalized guidance. Understanding the difference between high and low blood pressure is crucial for maintaining good heart health. Blood pressure is the force of your blood pushing against the walls of your arteries. When this pressure is consistently too high or too low, it can lead to various health issues. High blood pressure, often asymptomatic in its early stages, can lead to severe cardiovascular complications if left unmanaged. It is often called the silent killer because it can quietly damage your body for years before symptoms develop. Regular monitoring and early detection are key to preventing long-term damage. Low blood pressure, while not always a cause for concern, can sometimes indicate underlying health issues and lead to inadequate blood flow to vital organs. Symptoms of low blood pressure can include dizziness, fainting, and fatigue. It's important to understand what your blood pressure readings mean and to consult with your healthcare provider if you have concerns. By adopting a proactive approach to monitoring your blood pressure, making healthy lifestyle choices, and seeking timely medical attention when necessary, you can effectively manage your blood pressure and reduce your risk of complications. This includes eating a balanced diet, exercising regularly, avoiding excessive salt intake, and managing stress. Remember, knowledge is power when it comes to your health. Educate yourself about the factors that can influence your blood pressure and take steps to maintain it within a healthy range. Regular checkups with your healthcare provider can help you stay on track. By understanding the nuances of blood pressure, you can take charge of your heart health and live a longer, healthier life. Empower yourself with the knowledge and tools to make informed decisions about your health and well-being.